So let's dive right in. So we're talking about strategy, the numbers, and competitiveness today. And I'm going to start with my 3 rules. So the first rule is I want you to match the very best place that you can match, that you want to match at. There's no number one or best program. This is very important. There's only your number one. Everybody's number one is going to be different, so there is no number one program. And there's no guarantee you will match. So every year there's a surprise. There's a student that we're shocked didn't match. And we're going to talk about why that happens, what that phenomenon is. About 100 students a year don't match in emergency medicine. All right, so here's our goals. We're going to talk about the art of war, strategy. We're going to talk about the match statistics, what the numbers look like, and it'll be the numbers right from the last match, hot off the press. And then we're going to answer the question, mirror, mirror on the wall, am I competitive? So let's go right into strategy. And strategy is the art of war. It's a game. It's playing a game and knowing the game's rules. And the match, just like a lot of things in life, is just a game. If you know how to play the game, if you know what the rules are, you'll succeed at the game. So that's what we're going to talk to you about in this session and then all throughout the day. And we're going to talk about strategy from the perspective of my then 6-year-old daughter, Abby. She was 6 when she learned the word strategy. And now she's 14, and she tells the story that I'm about to tell you all the time. So she was at the Lincoln Park Zoo's egg extravaganza. It really is an extravaganza, egg extravaganza, in Lincoln Park Zoo in Chicago for the annual Easter egg hunt. And they do a really great job. So if you've ever been in Chicago, Lincoln Park has a huge sprawling area where they cover it with eggs. And they invite kids from all over the city. And you can imagine how many kids show up. And she really wanted to get a bunch of eggs. And I was on single parent duty that day. I took her by myself. And I was really worried. She's kind of smaller. And I knew she was sort of fast, but I was like, she might not get many eggs. So I'm like, it'll be good if you get like 3 or 4 eggs today. That'll be really good. And I tried to set, this expectation for her. So she goes up to the starting line. So you can imagine the Easter Bunny is here. This is this yellow ribbon. And she gets right up to the front of the ribbon. And she has to cross this bridge over the Swan Pond. And then all of the eggs are over there. And they just sprawl out like several football fields long. And there's so many kids behind her. There's hundreds of kids behind her, much taller, what I assume are much faster. And then the countdown begins. 10, 9, and I'm like, Abby, you've got to run really fast. 8, 7, 6. You're going to run past the eggs that you see first. Go past them, go all the way to the end and get those eggs. Those are the eggs you want. 5, 4. She's like, why am I doing that? I'm like, just believe me. Go all the way to the end. 3, 2, 1. So Easter Bunny clips the ribbon, and she's like a bat out of hell. Right out the gate, and I barely see her little pink coat at one point. She just keeps running. And I finally get to the back, and she's got her egg basket full. She's got eggs in her pockets. And what happened to all the other kids? All the 100, hundreds of other kids stopped at the cornucopia, and they were dead, right? Just like Hunger Games. So why did she get so many eggs? Oh, she even got the tiger egg, which is very badass for a 6-year-old. Why did she get so many eggs? Strategy. Because she had an advisor. That was me. So I understood how the game was played. I knew her strengths relative to her peers. She was kind of fast, but maybe not the fastest. I gave her goals ahead of time. I set realistic expectations for those goals. I was someone she trusted, and I helped her develop a strategy. And that's what you want. You need, this just fell off.
We do take full credit for your match. Just so you know.
We'll do it this way. So people who don't match, people who don't match because they didn't have an advisor, or they got the wrong advisor, or they didn't want to listen to their advisor. There's always this one rogue student every year who decides, I can do this on my own. I don't need to make all those meetings and meet with that advisor and prep for those meetings and have all my data. I don't need to do it. I don't need to do all that. I'll do it on my own. It'll be easy. And they're the ones who don't match. So you want to listen to the right people. And who are the right people? The right people are residency leaders who know the numbers from last year. The right people are residency leaders who know the numbers from last year. Not the really nice faculty member that you worked that overnight shift with. Certainly not the residents. The residents, are they going to tell you you're competitive? They're absolutely going to tell you, right? They're like nice, normal people. They want to encourage you in the match. Of course you're going to be fine. Everybody matches in emergency medicine. Totally untrue. You can listen to residents about what they thought about programs on the interview trail. That's legit. But they have no idea what the numbers are. They have no idea whether you're truly competitive, what your file looks like, and you can't listen to them. So residency leadership are the only people that I would seek out for your advising, and the only ones I would truly listen to. So who else should you not listen to? You shouldn't listen to your uncle, the orthopedic surgeon. He has no idea how the emergency medicine batch works. So don't listen to folks from outside your specialty, including your dean. You don't want to listen to other students on the interview trail. So when you go out on the interview trail, you're going to be these little holding areas waiting for your interviews. It'll just be students, and the students are going to talk to each other and gossip about the program across the city and where they went and such. And it's kind of like, you know what Student Doctor is? It's like Student Doctor Live, the musical, right? It's just horrible advice being spewed by people who don't really know anything about these programs. And don't be fooled. Just sit in the room quietly, listen to it all, let it go. None of it's true. And then I would say you have to cancel your studentdoctor.net account today. If you have one thing you learned today, it's just go home and cancel it. There's no reason to go on that website. It only causes pain and stress. So just get that out of your life early. All right, so that's strategy. Let's talk about the numbers. And we're going to talk about just how competitive it is. So this slide I make every year for academic life and emergency medicine for batch advice. And we go over it in an annual episode called Program Directors Reflect on the 20 whatever batch, the 22 batch this year. It was just published a day or two ago on Academic Life's website. So this it's a busy slide. Let me just kind of point out some stuff. Do I have a pointer? Yeah, so this is the last 10 years of data, and look how many new programs happened in the last 10 years, 100 programs. So you're too many programs in emergency medicine, far too many, and they've cropped up very quickly in the last few years. So with that, the numbers of open positions obviously went up. There's more positions to match to, and most of those positions get filled, as this unfilled position column shows you, and there used to really be no available positions effectively in the scramble, right, or the SOAP. There's usually 20 or less, some years 0, and so matching through the SOAP is not a viable option in emergency medicine until this past year when 219 spots were open, where I think we finally saw the effect of having too many programs and started diluting out the applicant base. You'll notice that the applicants from the LCME schools, so the LCME schools are allopathic schools in the United States, Puerto Rico, and Canada. So they're the allopaths, as opposed to the osteopaths and international medical grads. So there's really been very steady interest from the LCME students. And by and large, there hasn't been a big increase. In fact, there was a big decrease this year. Why was there a decrease? The jobs thing, right? That scared everybody. Whether you believe the jobs report or not, it certainly had an effect on the match. So the percent filled by the LCME seniors is a very important marker of competitiveness. It's not, did the program fill? It's what was the percentage of spots that were filled by allopaths, right? So if you're an international medical grad, what's the first thing you do when you look at a website? You look and see, did they ever take another international medical grad? If not, I'm not applying to that residency, right? So not all residencies take the international medical grads, for instance, and that percent LCME matters. So the number of positions filled in emergency medicine is generally close to 100, if not 100%. Like effectively, there's very few spots open, except this year we dropped to 92%. And that's really got the specialty up in arms. The chairs meeting was just a few weeks ago, and they had an entire session on these numbers and why it happened. And the chairs are really nervous about it. It's not just residency directors. And if you look at this percent LCME fill rate, there are some combined programs, they're very small, that fill at 100%. And then you see the surgical subspecialties that are fancy, like plastics and thoracics, they're close to 90%. But then you find us way down at 54%. We used to be right next to surgery and OB. That was generally where we lived. And what I would say was moderately competitive. That's what I used to say at this talk every year. And I would say we're not competitive. Like, not at all. We're below PEDS. Something happened. The interest isn't there. Maybe it was a jobs report. Maybe there's too many programs. Maybe it's a confluence of all these things. But if I was to assess, is it a competitive specialty? I'd say no. Now, in certain markets, very competitive. San Francisco, Boston, you have to treat that as if it's a very competitive market. But beyond, a couple of big cities, I think everyone can find a spot. It's clear that there's going to be ample spots probably every year from now on. So, are we competitive? I would say no. But let's talk about your competitiveness. So why do students not match? They didn't listen to their advisor. That's number one. Maybe they didn't have enough of a mix of programs, right? They didn't have their REACH programs and their safety schools. Maybe they didn't have enough geographic mix, so they only applied in Boston and San Francisco and nowhere else. Or they only applied in California, which tends to be more competitive than the rest of the country, nowhere else. Or they were just a bad fit. And we can tell in an interview when they're a bad fit. Like the residency directors are pretty good at this, and like within a couple minutes, can think, oh, you should be a neurologist, you shouldn't be emergency medicine, right? Like you can tell some of the answers, and that bad fit for emergency medicine certainly plays itself out every year. So when you get this advisor that knows the numbers, you also need to find one that's honest and is going to actually tell you what's wrong with your file. You don't want someone who's going to say everything will be fine. Gisondi thinks the match isn't competitive anymore. There's spots for everybody. And it'll be okay. You want them to really critically analyze your application. And the things they're looking for are the big red flags. So did you fail something? Like, did you fail an OSCE? Because that's going to show up in your dean's letter that you had to remediate something. So if you have to remediate something, that's a problem. It doesn't mean you can't match. It just means your application has to reflect how you remediated strongly and what you learned from the process. But only an advisor could help you kind of navigate that water easily. So you really need to find a trusted advisor and one that's going to be honest about your file. So when you assess your competitiveness, it really depends on what you're competing for, right? So if I was competing in a tabletop game of Uno right now, that would be very different than if I'm competing in the match, right? So the rules of the game are really indicate what you have to do and how competitive you truly are. So again, you need advisors to tell you that. And I would say, if you're an average student, certainly above average, if you're an average student, you're going to match in emergency medicine. An average student, so middle of the class, not a bunch of honors, maybe with some high passes, average step score, you're going to absolutely pass the muster you're going to get in. So there's plenty of spots for you. If you're below average, then I think the EM may still be out of reach. But you need someone to tell you that you're below average. Now, I would think most people in this room can say I'm average or above average. I bet you can think that. Your class ranks and things like that. So if you can't, let me give you very stressful numbers. All right, so this is going to be class rank. So this is really stressful. So if you're in the top quintile, you're above average. Congratulations, don't be a cocky ass. Don't tell everyone. And you don't have to apply to that many programs. So this is number one, right? So you're all going to over-apply, and we're going to tell you every year, don't over-apply. You're wasting money. You don't need to do that. You're only taking interview slots from your peers, and there's no need. And this group is terrible about doing that. The bunch of AOAs are such gunners, and they're going to take all the interview spots right at the beginning, and this is terrible. So really, just apply to 20 and take 10. You're going to match at your number 1 or 2 if you're really in this group. If you're in the middle quintile, you're average, and you absolutely will match. And the numbers that you should apply to are 30, and you should take 12. And this is based on NRMP, National Residency Matching Program data that's released every year, where they show this curve, and it's the number of programs that you apply to, and then the likelihood that you're going to match. And at some point, the asymptote hits so that you don't need to apply to any more than 12. If you apply to 13 or 14, it doesn't change your match rate at all. It flattens out at the top. So why would you go on 13 interviews? You just don't need to do it. So apply to 30, that's your max. Take 12 interviews, you'll absolutely match. If you're in the bottom quintile, EM is not necessarily a guarantee for you. Okay? Let's do it with step scores. You're the last cohort, right, to have numbered step scores. Lucky you, right? Lucky you. All right, so this is really stressful. So if you have a 214 to a 251, statistically speaking, you're average. So someone in this room got a 251 and they're pissed that I'm telling them that they're average. But it's a criterion reference test, right? So a standard deviation away from the mean is the same thing. So a 213 and a 251 are essentially the same number, or a 214 and a 251 are essentially the same number. Now, no one treats it that way. They treat it as an ordered number test, and they think a 250, if they mean the program leadership thinks it's. But they're just bad at math. Your average if you fall within the standard deviation. If you're a standard deviation or 2 above, that's statistically significant achievement in my mind. That means you can take tests a whole lot better than everyone else. Doesn't mean you're going to be a better doctor. This is about test taking skills. And why, as a program director, would I care about test taking skills? Because you actually have to pass your boards at some point. And if I have to spend 3 or 4 years teaching you how to pass your boards, I'm doing that at the expense of all this other cool stuff I could teach you. But if I know that my entire class can pass boards because they did well in the step, then I don't teach the exam questions. It doesn't matter anymore. A lot of the innovation and stuff can be included in my program. So we care about step scores only for that reason. Now, when it goes to pass-fail, there's going to be a whole host of other holistic factors we're going to have to look at. But right now, step one probably still matters to you guys, at least for the last year. And then if you're a standard deviation below the mean, you're statistically significantly bad at taking tests. And that's a problem. I would have to be very concerned about remediating a student who's a standard deviation away from the mean. So that's a problem. And emergency medicine, not necessarily for you if you're in that ballpark. You're going to have strengths in other areas. And certainly clinical rotations and things you might shine at, because test taking doesn't indicate whether you're going to be a good doctor. It just indicates whether you're good at taking standardized tests. So you may knock it out of the park on your rotations, get a bunch of honors, and still match. But you have to be concerned about it. So do you take step two? And this is a strategy question. So if your step one is low, then you have to take step two. And you probably know this already, but step two, your scores generally go up if you're going into EM. There's certain specialties that just do better on step two because it's more of a clinically oriented exam. And your scores probably will trend up a little bit, but will they trend up in a way that's statistically significant like you do? That's something to be considered. Those stats numbers generally, again, show how well you are at taking tests, how good you are at taking tests, not necessarily your clinical knowledge, right? If your step score is fine, average, remember average people will match, average to above average, then bury step two later in the season. Because you don't want to risk step two in July or August and happen to wake up that day and there's a death in your family or you have gastroenteritis or something takes away your ability to just do as well on that test as you could. And that score will be available at the time that interview decisions are being made. And you might not get an interview because your step score went down. So that's a problem. So if you have a good step score, at least an average step score, bury it later in the year or take it in November or December when all the interviews have been given out. Most of the interviews will be gone by the middle of October. A couple programs, will go to the end of October. The vast majority of the interviews will be done. So all of the things in your file kind of mid-October are the things that really matter. So you do have to take it, though, early enough that your step two score is available by the day that the ranked order lists are due, which is usually the third week of February. Now, you could take it later, but most programs won't rank you without a pass on step two, because a pass on step two is required to get licensed in most states. And if they match somebody who can't be licensed, that's a big problem. And that can happen to programs that don't require a step two. So you're probably not going to take it like November, December, but I don't think that score is really going to change where they rank you. Usually, once you get an interview, then like the playing field is level, and then it's interview day, and that's really what determines your rank position.
I have a question.
Yeah, of course.
For those of us with a pass-fail step score, do you recommend taking it earlier and you guys going to be looking at a step two score versus?
I bet we do. I would say the natural human tendency is to find the next piece of data because we want to know who's better than who. And that's really unfortunate. The whole point of it going pass-fail is to encourage holistic review of applications. But you hear those words all the time, and how do you define holistic review? I think we sort of know. We look at past experiences. And, is there evidence of achievement in some manner that you grew from those challenging past experiences? Then there's just students who are good students who had a challenging life experience, and how do they fare in holistic review? So it's problematic. I don't think the program directors necessarily know how they're going to do this, and that was an unfortunate marker. And a lot of people maybe didn't care as much about the step score because they understood all this nonsense and they recognized its limitations. But it was something that if you had a 270, that's dramatic. That is a big statistically significant increase over the mean. That probably did catch people's attention. So now that it's pass-fail, what are they going to use? Maybe class rank, but a lot of schools have stopped ranking, and that's become a very common experience around the country. And the LCME schools just don't rank. So now that's going to be gone. So what are they left with? Your clinical rotation in emergency medicine becomes so important. Did you get honors on your EM rotation? Because there's really going to be very few other markers to choose from. And then step two, I think, will be considered. It really hasn't been considered to this date. I never, as a program director, looked at step two with any great interest other than to see the very few students who went down. And I would really question, why did they go down? That's a problem. Maybe they're not a fit for EM. But generally speaking, I didn't really care if you knocked it out of the ballpark in step two. I didn't know what to make of that. It's everybody. So So a little bit of those, this depends on where you want to live. So if you really, really want to live in San Francisco or Boston, you would probably have to recognize that you may not get every interview that you want unless you're truly an above average candidate. So I would say, the rule is, in a difficult market, for every application that you put into that market, you should do 2 in an area of the country that perhaps isn't as difficult. Because you want to have those reach schools and schools that perhaps are going to have an easier time giving you interviews. This is difficult if you have severe geographic limitations. Your partner has to take a job at a city that only has one emergency medicine program, and you're sort of fixed to that EM program. But that's problematic, and it's going to throw off all your numbers of how many you're really going to interview at. Some for safety perhaps, but you're going to have all your eggs in one basket. And then overall strength of application matters. Oh, the answer to the question was on the slide. Good for you. All right. So what did we learn in 20 minutes? We learned to get an advisor. We learned that EM really is not competitive anymore, and that average applicants match. And this is truly like a different slide than I've had at this talk for many years. And I was always concerned about the average student. I'm not anymore. I think the numbers will play themselves out soon. That's my guess. That's my understanding. All right, what questions do you have? Yeah.
I have 2 questions.
Uh-huh.
So my first one is, it's reassuring to hear you say that, but do you not think that this dip is going to be something that people look at and then will rush to EM and then it'll shoot back up?
Oh, well, I don't know. The thing that everyone compares it to is when anesthesia had the same. Have you heard this? So anesthesia, when I was a medical student, a very, very long time ago, so late 90s, in late 90s, anesthesia had the same thing, a workforce study that showed there were too many anesthesiologists. And at the time, anesthesia brought in bank. They made tons of money, and it was the specialty you wanted to go into. And they said there are no jobs, and their match rate was terrible. Top programs in the country got unfilled spots. It was catastrophic. And anesthesia, it took many, many years for them to rebound, and they're still not as sort of desired and competitive. Their salaries went down because of this, because there was too many anesthesiologists, so supply and demand. So I don't know. I mean, they didn't bounce back right away. I don't think that we're necessarily doing. Again, those numbers for the LCME students went down a little bit this year because of the workforce study. And even if they bounce back up to what they were before, there's still so many programs, and they're coming online every year. There's another 3 new programs this year. At some point, our specialists stop taking new programs because we're just diluting out the spots. And and it's a lot of the new programs that were the ones that went unfilled this year. But it affected some old and storied programs too, which is a little bit scary. Places that have been around for 30 years that should fill automatically to have. So to answer your question, it's hard for me to predict. I would guess that number stays pretty stable, that unfilled number. But we have to see how it compares.
Thank you.
Yeah.
My second question is, do the numbers change with how many programs you apply to if you're focused on?
Oh yeah, I would apply more. Yeah, and not because you're not competitive, because you have to agree, right? Like you might like one program and your partner might not like that program, and so then that city is out, that program is out. So you want to have enough that you can line up the top schools and make some configurations that work, and that just means you need to apply more, but not necessarily because you're at risk of not matching, unless one of them's the anchor. You look at anchor, the one that sinks the ship, right? So if that's the case, if there's an anchor, then that's a little problem. If you're just average students, which most students are average, then that's a good thing. You'll probably be. You don't want to know all the words the PDs have. It's just the beginning. It's just the beginning. Come with lunch, I'll tell you all the words. All right, thank you guys very much. It was real cool.
Thank you.
Thanks, Mike.
So while Dr. Hiller's getting her slides together, I'm interested in some of the questions you guys are asking as a Med 4 director. I'm a little worried that students are going to be taking a lot more time now for Step 2. I don't know what you guys think, but I wouldn't advise, just because you have a pass-fail Step 1 and you feel like there's higher stakes for Step 2, I don't think you need to take 8 weeks in your Med 4 year for Step 2. So that's been my new kind of advising angle, because I just worry, that students are going to keep taking more time out of the Med 4 year to focus on the match and not really becoming better doctors.